Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, Zenker's diverticulum treatment. So, in the treatment of Zenker's diverticulum, okay, actually, Zenker's diverticulum, the best therapy here, sorry, in the treatment of Zenker's diverticulum, the best treatment or the best therapy is surgical management is better rather than medical management. So surgical therapy is actually the treatment of choice. So in the surgical therapy, actually cricopharyngeal myotomy is the treatment of choice for Zenker's diverticulum. Cricopharyngeal myotomy with diverticulopexy is the treatment of choice for Zenker's diverticulum. So in actually cricopharyngomyotomy. So here you will sorry, this is the cricopharyngeus, this is the thyropharyngeus, and there is a diverticulum below. So you will do a cut, you will cut this cricopharynx and cricopharyngomyotomy, and you will take this diverticulum and you will attach this diverticulum to the uh, upwards, like you will invert it like this. So if this is the esophagus, okay, if this is the diverticulum, actually this diverticulum will be like this. Now you will invert the diverticulum and you will fix it like this. If you fix the diverticulum like this, then obviously the food, even if it won't regurgitate at the first point, it won't enter. Even if it enters, due to gravity it is easily falls out. So you will cut the cricopharynx and you will fix the diverticulum inversely like this. So this is cricopharyngomyotomy and diverticulopexy. Right now, after this, so the treatment actually depends upon the size. So if the diverticulum is very small, then we can do a cricopharyngomyotomy is sufficient. Just myotomy alone will be sufficient if it is a smaller diverticulum. If the diverticulum is large, very large, then you should even excise the sac. Diverticulopexy is not sufficient, because if it is a larger sac, instead of doing a diverticulopexy, it is better to excise the sac. That is, diverticulectomy can be done. Then the third type is, actually we can do a diverticulopexy, and even a diverticuloesophagectomy can also be done. Diverticuloesophagectomy can also be done with the help of the linear stapler. What is this diverticuloesophagostomy? Sorry, diverticuloesophagostomy. Here, if this is the diverticulum like this, now you will take a stapler and you will divide it between the esophagus and the diverticulum. That means you are going to divide this part like this. Okay, once you divide it like this, then you will be left with something like this. So this does not look like a diverticulum, it's just a large pouch, so that the food easily passes through it. So this is Dolman's procedure, which is an endoscopic procedure. So treatment of Zenker's diverticulum is mainly surgical treatment.
thank you and thank you for watching.